Hello students, good day to all. In this video we are going to see about maternal sepsis. I am Ms. Ruth Kesia, working as a tutor in Triple College of Nursing. So the objectives of this video are we are going to learn about introduction on maternal sepsis, definition, how to diagnose, immediate management, follow-up management, origin of infection and HIV in pregnancy causing maternal sepsis. So these are the topics we are going to see through these videos. Introduction. Sepsis is a life-threatening illness caused by a severe infection spreading through the blood, and it may be complicated by multiple organ failure. Sepsis is one of the most important causes of maternal illness and death. So sepsis is the most important cause of maternal morbidity and as well as the mortality. And sepsis means the infection which has spread through the blood. So it will cause multiple organ where the blood passes throughout the body, right? So wherever the blood goes, it causes the sepsis to that particular organ also. So in turn, it causes the multiple organ failure. Definition: a woman can have sepsis when she is still pregnant or after delivery. If a woman appears not looking well, having poor general condition and feeling weak, you should do the following measure. That is, checking the blood pressure, pulse, temperature, respiratory rate and level of consciousness. So if you suspect a woman with maybe she may be a pregnant or she may be after delivery, if you suspect the woman is having some sepsis, it means she may be looking poor, having this poor general condition, she looks sick, okay, and she'll feel weak and fatigue. Okay, she will not be able to do anything else, and so in that time you have to suspect sepsis for this mother, and you have to check the following things, that is the blood pressure, pulse, temperature, respiratory rate and level of consciousness. She has sepsis if there is a reasonable suspicion of infection and two of the following, that is pulse above 90 per minute, respiratory rate above 20 per minute and temperature above 38 degrees Celsius or below 36 degrees Celsius. So two of the condition, either the pulse may be above 90 per minute and the respiratory rate above 20 per minute and the temperature above 38 degrees Celsius or below 36 degrees Celsius. So you need to check the vital signs in order to confirm, okay, suspect if the mother is having any infection. Okay, these are the criteria, how the pulse, respiratory rate and the temperature will be. It is important that sepsis can be present without fever. She has septic shock if she presents with the following despite adequate fluid resuscitation, that is systolic blood pressure below 90 mm mercury or urine output below 30 milliliters per hour. Okay, so even if the mother has the temperature normal, in the normal temperature also the mother can have septic shock, right? So without the fever also septic shock can be there in the mother. Okay. So what will be the other signs and symptoms? The blood pressure will be below 90 millimeters of mercury and the urine output will be below 30 ml per hour. Okay. Immediate management. A woman with sepsis needs urgent treatment. First, she must be stabilized, call for help, then go through ABCD. Okay, so sepsis needs immediate treatment. It means we already saw the sepsis means the infection is has spread to multiple organs. So important organs like brain, lungs, liver, okay, kidneys, heart. Okay, these are the important organs. Okay, so if the infection has spread to all these organs, it can cause multiple organ failure. Okay. So in that case, you need to act very fast. First, you must call for help, then go through A, B, C and D. Okay, A means position the airway, so the airway is free. So as you see in the picture, you have to do the head tilt and the chin lift, so the airway is free. Okay, breathing. If the mother is normally breathing, you need not do anything. But if the mother is gasping, okay, we already saw it affects the respiratory rate also. So if the mother is having gasping, you know what is gasping, right? So if there is gasping or if there is no respiration at all, then you must go for ventilate with bag and mask ventilator. But otherwise, if the mother is breathing by normal, you need not do anything. Then the third one is the C, that is circulation. So for circulation, you need to insert two IV cannulas, 2 liters of normal saline or Ringer's lactate intravenously in the first hour. And then insert a urinary catheter to monitor fluid input and output. Okay. So you have to give the fluid and you have to monitor the fluid which is coming out also. Okay. How you give in? So we insert a cannula, that is IV cannula size 16 or 18, so that you can rush the fluids, because we have to give 2 liters of normal saline or Ringer's lactate in an hour. So you always should prefer for the bigger cannulas, size 16 or 18 gauge IV cannulas. Then you have to rush the Ringer's lactate or the normal saline. Then also you have to drain the bladder by inserting the Foley's catheter, and hourly urine output should be maintained. So then the fourth one is the D. Okay, D stands for drugs. Give antibiotics according to local guidelines. So we know that this is the infection and it is caused by some microorganisms. So whichever infection is there, we always treat it with the antibiotics, right? So you give the antibiotics according to the local guidelines. It means the hospital policy. For example, you can give ampicillin 2 grams every 6 hours and gentamicin 80 milligrams intravenously every 12 hours, or metronidazole 500 milligrams intravenously every 8 hours. So these are the usual choice of drugs given in case of sepsis. Okay, but you can also use this artesunate IV or IM. Okay, 2.4 grams, 2.4 milligrams. So if in a malaria risk area, treat according to the local guidelines, often prefer this. Yeah, so this artesunate is preferred in the malaria. So if you suspect the mother is having malaria fever, so you give this artesunate injection, okay, either intramuscularly or intravenously. Or you can also give this quinine IV, okay, intravenously. And chloramphenicol should be avoided for the pregnant and lactating women. So one thing you have to keep it in mind, that this chloramphenicol is contraindicated in case of pregnant and lactating women. And continue antibiotics. So whatever, if there is no malaria, you will be giving this metronidazole and ampicillin. Okay, but if you suspect malaria positive, then you are going for this artesunate and quinine. So whatever the antibiotics you are giving, so you have to give it for 48 hours after the woman is fever free. Okay, so a mother has admitted and you have started the antibiotics and you have given for 5 days. Now this fever is suspected. After the fever is settled down, after the settled down of fever, you have to continue the antibiotics for 48 hours. So that's what it means. Okay. Next, we'll see about this follow-up management. Assess the vital signs every half hour until stabilized. Okay. If in a peripheral facility, refer to a higher level of care if possible when stable. Intravenous fluid treatment is important. 2 to 6 liters of normal saline or Ringer's lactate may be necessary over the next 12 hours to maintain a blood pressure of at least 90 millimeter mercury systolic and a urine production on average above 50 milliliters per hour. So follow-up management. So you have come across this ABC and started the drug also. Now we are coming for the follow-up management. In this, what you have to do? Same, you have to monitor the vital signs every half an hour until the woman is stabilized. It means the pulse is below 90 beats per minute and the respiratory rate is below 20 per minute, and if the woman is having fever, the fever is settled down and the temperature is normal. So that is called stabilization. So till the stabilization, you have to assess the vital signs for half an hour once. If in a peripheral facility, you have to refer the patient for a higher level of care. Okay, intravenous fluid treatment is important. Okay, you have to give, I already told that you have to give the IV fluids about 2 liters in an hour, and also you have to maintain the urinary output. Okay, till you get this, how long you have to maintain this in and output, okay, till you get the BP of 90 millimeters of mercury in systolic, and the urine output should be increased, okay, should be improved at least 50 milliliters per hour. Till then you have to do this follow-up management. Fluid in and out should be measured. In sepsis, it should be calculated every 8 hours. In septic shock, it should be calculated each hour. Okay. So now we'll go to this. Now we have settled the women. Okay, the vital signs is stable. You have did the follow-up management and everything. Now you are going for the identifying the cause. Okay, identifying the cause is very important in case of fever. Women with the fever. Only then you can only if you identify the causative agent, you will be able to settle the fever. You will be able to cure the disease. Okay. So how we are going to identify the cause? The origin of infection should be identified for the further planning of treatment. Infection causing sepsis are usually bacterial, can have their origin in many places. Think of 6W. Okay. So this identification of causative agents, you can think of 6W, that is womb, weaning, wind, water, wound, and wings. Okay, these are the 6Ws. We'll see it one by one. Womb. Consider an infection in the uterus until proven otherwise, and especially if it is tender, there is lower abdominal pain and foul-smelling vaginal discharge. Before delivery, the infection is called chorioamnionitis. So as you see in the picture, okay, if the mother is pregnant and she is having suspicion of having sepsis, okay, the infection has gone to the bloodstream, okay, then it is called chorioamnionitis. Treat with intravenous antibiotics. Pregnancy should be terminated within 12 hours. So you see in the picture, okay, the pregnancy should be terminated. You induce the labor, okay, and terminate the pregnancy within 12 hours. And after delivery, if the infection is called endometritis, okay, so before delivery it is called chorioamnionitis. After delivery, the womb infection is called endometritis. Treat with intravenous combination antibiotics. If no effective antibiotics after 24 hours, the patient should be sent to a higher level facility for gentle evacuation of the uterus by gentle curettage. If there is no still improvement after another 24 hours, laparotomy is needed. So after the delivery, the infection is called, as you see in the third picture, the infection is called the endometritis. So in that case, you have to refer you have to start the antibiotics and refer the woman for gentle curettage of the uterus. As you see in the picture, the curettage instruments are given in the picture 4. And even if the after the curettage the infection is not settled, okay, by curettage probably will remove the retained placental beds or anything causing infection into the womb, okay. So even after it is not settling down, you have to go for the laparotomy, okay, to remove the cause, okay, of the infection. So the next W is weaning. Okay, weaning means it is an infection in the breast causing mastitis or an abscess. Add mastitis to the breast, must be emptied by baby sucking effectively, or express the milk and give it to the baby, or discard the milk. Dicloxacillin should be added 1 gram intravenously every 6 hours if there is an abscess. Surgical drainage is needed. So weaning means it may be mastitis. Mastitis means infection of the whole breast. Okay, the it may be one side or bilateral. Okay, unilateral or bilateral. But abscess means it is a particular area in a one breast. Okay, causing pus. Okay, that is called abscess, a collection of pus inside the breast. And so in case of mastitis, what you should do? You should empty the breast. Either put the baby on the breast to suck the milk completely, otherwise you express the milk and discard it, or keep it in the refrigerator to feed the infant. And if there is mastitis, you have to express the milk, okay, and 1 gram of dicloxacillin IV every 6 hours should be prescribed for the woman. And if there is any abscess, you have to advise the mother for abscess, surgical drainage of the abscess. So that is about the weaning. Okay, next we'll see the wind. Okay, wind means respiratory distress. Consider pneumonia that is treated, for example, penicillin. And pulmonary tuberculosis is another cause of infection in the lungs, and respiratory distress. Always think of preeclampsia and anemia as differential diagnosis to keep a close eye on the bleeding. Okay, so next is the wind. So if the fever, if you suspect caused by the wind, that is either upper airway infection or a lower airway infection, okay, URI or LRI, okay, you have to consider pneumonia or pulmonary tuberculosis, okay, and according to the infection, you have to treat the patient. Also, you have to think of the preeclampsia and anemia. In this case, also the mother will be having breathing difficulty. Okay, respiratory distress will be there. And if you suspect preeclampsia or anemia, you have to keep an eye on the bleeding, because in both these cases, the bleeding will be more. But if the bleeding is controlled and less, and the uterus is well contracted, but the mother is having fever because of the wind, then you can suspect for pneumonia or pulmonary tuberculosis or other respiratory tract infections. Okay, and treat the infection according to the antibiotics. Okay, local policy. Next, W is the water. So we saw about the womb, weaning, and the wind. The fourth one is the water. Suspect urinary tract infection if unclear or bloody urine, discomfort when passing urine, or pain over the kidneys. Urosepsis is usually treated with ampicillin and gentamicin. Okay, so if the mother is having bloody urine or discomfort while passing urine or pain over the kidneys, if these symptoms are there, you have to suspect for urinary tract infection. And urosepsis, if at all occurred also, it can be easily treated with ampicillin and gentamicin. The next W is the wound. A wound is infected if there is discharge and if the surrounding skin is red. Examine the legs and arms for cellulitis due to infected drip site. So these also can cause fever in the woman, right? A wound might be infected, and if it is infected, it's going to look unhealthy. The skin will be red and there will be some discharge. It can be, the discharge can be either serum, a clear liquid, or it can be pus also. So if it is not present, you can also examine the legs and arms for cellulitis, because we are introducing so much of IV line, right? So the thing that IV drip site can also cause cellulitis in the legs and arms, so that also you should examine. At wound infection, so if at all there is wound infection, you can add dicloxacillin 1 gram intravenously every 6 hours, and if there is no improvement, you have to refer the mother for surgical revision. Okay, surgical revision means they will excise the wound, the dead unhealthy skin, and stitch it with the healthy skin together. Okay, this is what the intervention is done if the wound is infected. Then is the wings. Okay, the last W is the wings. If you are in a malaria risk area, you should first perform a malaria test if available. If unavailable, treat with anti-malarial drugs. Make sure all patients at your facility are protected by impregnated bed nets. Okay, so if you are suspecting the mother is having malaria, then you should perform a malaria test, and you should start with the anti-malarial drugs, and you should also give the bed nets. Okay, and also you should consider appendicitis, the right lower quadrant pain with rebound tenderness. Though in the pregnant woman, as you see in the picture, the appendix is located a little bit higher. And you can also suspect this cholecystitis, that is right upper quadrant pain with rebound tenderness. Okay. And if there is neck stiffness, the patient may have meningitis. After stabilization and initiation of intravenous antibiotics, send the woman to a referral health facilities for further management. So if you suspect all this appendicitis, cholecystitis and meningitis, you have to start the antibiotics and refer the woman for further management. So HIV is the another thing you should consider in mind. Okay, so HIV is common among pregnant women and can complicate the assessment of maternal sepsis and ensure that HIV status of all the women is known and that appropriate antiretroviral therapy protocols are followed. So HIV infection you should exclude it. Okay, when you are suspecting any infection in the woman. Okay. So this is about the maternal sepsis. What all we saw the introduction about the maternal sepsis definition, okay, and how you are going to management, immediate, what is the immediate management and what is the follow-up management, and how we are going to identify the causative organism, that is origin of infection by 6Ws, which is which is that which is 6Ws, okay, that is womb, weaning, wind, water, wound and wings, okay. If there is womb at chorioamnitis and endometritis, you have to do the gentle evacuation, start the antibiotics, gentle evacuation of the uterus, and if there is no improvement, you have to go for the laparotomy. Weaning, that it may be mastitis or abscess, you have to add a dicloxacillin. And wind, it can be pneumonia, so you have to treat it with penicillin. Water, so it can be a urinary tract infections, you have to treat the mother with ampicillin and gentamicin. Wound, you can add dicloxacillin and consider wound revision if the wound is not settling, okay, if there is still pus, okay, and serum discharge from the wound. The last one is the wing, you have to treat according to the malarial guidelines and local guidelines. If the malaria test is positive, also think of meningitis, cholecystitis and appendicitis and start the treatment and refer the woman for the higher level facilities, okay. So these are the things we have learned in this video about the maternal sepsis. I hope you gained some knowledge about maternal sepsis, and I hope this video will be very useful for you, and thank you once again. Thank you all.